Welcome! In this lesson we are going to discuss the case to be prepared for prosthodontics or implantation. One of the tasks here is creating a good and proper space for the future implant and the crown. This situation is especially relevant for grown-up patients who don't want to spend too much time on treatment or use braces. Because aligners are aesthetically attractive, these patients tend to prefer this very system. If we look at this setup, we can find a number of issues, including the crowding, the canine rotation, the local crossbite, but we are going to concentrate on implantation. The missing tooth here is tooth 3, the canine, and the space is not enough for implantation. And this is what we need to correct. We need this for good crown shape, and here not only the mesiodistal position is important, but also the vertical tipping correction. As you can see, we need to move the teeth distally and also to tip the crown distally. Now we are going to see how it was done by the Exceed lab. Let's have a look at the movements. This is the final position, and we are going to have a look once again. Pay attention that we move the molars distally, as well as the premolars, but also add the distal tipping of the crown. Now, if we follow the movements and the steps of the aligners, we can see that the good position for the implantation is achieved by the 21st or the 20th aligner. That means about 10 months of treatment. All the further movements are made to correct the other issues. The result is nice and the space is enough for future implantation. We should remember that every aligner can add about 2 degrees of tipping, that is about 20 degrees for 10 aligners, but these values can be slightly changed according to the clinical picture. And as you can see here, we have the button cuts to be used with elastics to make the movements easier and to achieve the better result in a shorter time. We can follow the steps once again and see the final result.